Everybody, if you wouldn't mind turning on your cameras just so that I can see all of your beautiful faces. Can we get some cameras turned on? Can everybody hear me? Thank you, Karina. Coca, thanks, Emily. Okay, yeah, if you're driving, you can keep your camera off, but if you're able, please turn your camera on so that we can give you credit. And if you are not able to turn your camera on because you're driving, just go ahead and let us know that too. Okay. All right, so we're going to go ahead and get started. I am going to make sure that we are recording this meeting. Yes. Okay, wonderful. So let me go ahead and share my screen. Alrighty. All right, so we're excited to check in with both our September and November fellowships from last year. This meeting really is just like another touch point for you guys for us to be able to touch base with you, make sure you're feeling okay, kind of tell you about upcoming things, and, answer any questions that you guys might have about any of that, okay? So we are going to talk about some housekeeping items. We're going to talk about how everybody's feeling, how everybody's doing, go over some like common feedback that we see on the unit just to make sure that you guys are kind of aware of all the things that you need to be doing. And then we're going to go over competencies, annual competencies, goals for the future, and closing questions and remarks. Okay. So housekeeping items, Vizient, for those of you that are attending Vizient, please make sure that you guys are not working the night before Vizient. We try to keep you off of that shift as much as possible. The scheduling committee works very hard to keep all of those things organized. Of course, sometimes, they're human, they make mistakes. But we want to make sure that you're not switching on to that shift. And if for some reason you are shuffled onto that shift, just let Jackie know because we really want to make sure that you guys are safe driving home. It's in person now, so we really want to make sure that you guys are not working a 12-hour shift, coming to Vizient for 4 hours, and then not getting home until, 12:30 in the afternoon. We want to make sure that your safety is first and foremost. If for some reason you are shuffled onto that shift or, you can't find switches off of the shift, again, please talk to Jackie. Attendance for Vizient, you do get 2 excused absences. They will have you complete a makeup assignment to kind of, account for that excused absence. And we really want to make sure that you guys are talking to us about that absence, talking to your facilitator, and making sure that you're communicating with the professional practice email. So that everybody is aware of, why you're absent, that you are absent, and that we can make sure that we are getting you that makeup work. Okay. Clocking out no lunch. So we really want to prioritize all of our team members getting a lunch break. If you are, in the middle of a shift that's really crazy, you can't get to lunch. You need to inform unit supervisors by 3 or 4 a.m. that you have not been able to take their lunch break. Really, this is the goal of this is to make sure that we can make sure that we're covering like all of our avenues of seeking out resources, seeking out unit supervisor to see if we can get coverage for that neighborhood. There really is no reason that you guys should not get a lunch break. We really want to prioritize that for you all. But if you clock out no lunch and did not communicate with the unit supervisor that you needed help, that you were drowning, those kinds of things, and all of those resources were not, exhausted, then Saj she is gonna change your time card to reflect that a meal break deduction was accounted for. Okay. So always make sure that you are taking all of those avenues before clocking out no lunch. Acuity requests. So, biggest thing now that you guys have been off orientation for a period of time is when does that acuity start to come, right? We want to make sure that you guys are all getting the experiences that you want. Biggest way to do this is to advocate for yourself, advocate for experiences, advocate for, a change of an assignment if it's appropriate, and please be patient and flexible. Biggest thing I would say is that, when you guys are on the unit, I know that you have your priorities with your own assignments. But also want to make sure that you guys are feeling comfortable, like throwing yourself into admissions, throwing yourself into those new experiences, being that second set of hands for those more experienced nurses. That is really the best way for our unit supervisors, for our charge nurses to get to know you and to say, oh, Karina has like thrown herself into every admission on the unit, thus far. She's really advocating for herself. She's pushing herself to continue learning, things like that. And that's going to be their kind of trigger to say, okay, we have really good support in this neighborhood tonight. Maybe Karina is up for that challenge of taking on a higher acuity assignment. Okay, so biggest way to kind of continue to grow your skills is to just continue advocating for yourself, just like we talked about on orientation. Calling out. So just want to go over some expectations with calling out and some of our kind of caveats with that. So each unscheduled absence or call out is one occurrence. Multiple unscheduled absences for the same reason on consecutive shifts or work days will be considered one occurrence. So if you're scheduled Monday, Tuesday, Wednesday, and you come down with the stomach bug, and you have to call out for all three of those shifts, that is one occurrence, not three occurrences. So just want you guys to be aware of that. Um, if you are too sick to come to work for two or more consecutively scheduled, oh, that's what I just went over. Sorry about that. You do still have to call out for each shift separately. The unit supervisors don't like pass along, for 3 days. It's just very easy for that to get lost in translation. So even if you, tell them on Monday, hey, I have the flu, I'm symptomatic, I have a fever, whatever it is, you still have to call out for that Tuesday and Wednesday shift before that 4 o'clock time frame, 4 p.m. or 4 a.m., depending on what shift you're working. Okay. Three unscheduled late arrivals or three unscheduled early departures or any combination is also one occurrence. So just wanted to kind of give you guys that breakdown. Weekend call out updates. So each team member will be permitted one occurrence prior to needing to make up a weekend call out in the rolling year. So, if you were to call out for this weekend, that starts your rolling year of, once you have a second call out from now until this time next year, then you would have to make up that second weekend shift. Okay. We've listed below the weekend shifts that, kind of cover that, are kind of encapsulated with that. And our unit supervisors are staying on top of this to make sure that we are having coverage and that we're not seeing, habitual call outs on weekends from team members. Okay. So how are things going? Really want to hear from you guys. I would just like to go around. There's, about 13 of you guys on right now. So really would just like to go around and hear from you. Have you started to see more acuity? I know some of you have been asked to like help with our new orientees, things like that. How are you being successful? How are you staying motivated to come to work? What are some good things about your shifts? What are some of the hardest things that you have found since being off of orientation? Really would just love to go around the room and hear from each of you. You can answer one or multiple of these things. But know that, you're probably not the only one feeling how you're feeling. So really want to hear from you guys. Does anybody want to go first? Sam, did you want to share?
See. Yeah. Can y'all hear me?
Yeah.
Okay, cool. So I guess for me, it's just kind of learning how to balance personal and work life, and like also I'm doing school as well, so doing those three things all together. and getting
Yeah.
all that is really the tricky part for me. Like work so much is just for me, it's like a matter of asking questions when I get confused or like when I'm like I don't know something. It's like always just getting to double check on myself, making sure that I'm not, like, doing something that's like, oh, we don't do it that way.
Absolutely. I think that's so important to keep a nice balance and, make sure that you're doing kind things for yourself outside of work. Especially with, doing school with work is it's essentially like having two jobs, right? So always make sure that you're finding that balance and that you are, doing kind things for yourself so that you don't feel overwhelmed in those moments when you're coming to work.
For
Wonderful.
sure.
Anybody else want to share?
Hi, good morning. I think for me, what has worked a lot is just like asking a lot of questions, especially to charge. I rely on charge a lot. So making sure like if I don't know something or if I even have a little bit of doubt, just to ask, even though I feel like sometimes it can be annoying, but I always make sure to ask. I feel like that's helped me a lot.
Yeah, that's wonderful. I think that, I hope that you know that nobody's ever going to look at you and be like, "Oh my God, Emily's on her fifth question tonight." Like that's nobody's ever going to feel annoyed by that. We want you guys to ask all of the questions, double check yourself. That's how you're going to continue to grow is to have that like reassurance and that validation that no, I do know what I'm doing. I thought that I had the answer. I was 90% sure. And those more experienced nurses coming in and saying, "Yep, you're exactly right." That's just going to continue giving you the confidence to grow. So, never wrong to double check yourself, even if you're pretty sure, because, in this patient population, if you make a calculated guess and you're wrong, you really can't take it back. So never lose that. We want you guys to ask all the questions. Who else? I'm gonna start calling on people.
I'd
Anybody want to
also like to
volunteer?
touch base with what Sam was saying. Are you guys able to hear me?
Yes.
Okay, perfect. Sorry, I'm driving, so please feel free to like if you can't hear me, just let me know. But um, along with what Sam was saying, I'm also trying to find a work-life balance with work life and also finishing up my BSN as well. So I definitely took the time like after the semester to um, make sure that like I know exactly like how to balance everything out, like planning my days and weeks ahead of time and trying to figure out what days I can schedule myself along with days that I can do schoolwork. Um, so I think honestly also just making sure that I prioritize my self-care and everything has helped a lot tremendously. Um, but that's about it. Everything's going really well.
Good. I love that. I think, just like I said to Sam, I think the biggest thing is you've got to find that balance that works for you because we want you, we don't want you guys to burn yourselves out in the way that you're not like enjoying coming to work anymore. You have so much bogging you down that you're not able to really enjoy the little things. So I love that, finding that balance, doing good self-care. That's important for everybody. Anybody
Thank
else
you.
want to share? The next person that I have on my screen is Shannon. Are you able to pop on and share?
Yeah, so I definitely feel like being off orientation now, I feel like I'm still learning things every day. Like sometimes I get a different case and there's like small things where it's some random things that even if I ask a question, people might not know. So there's like learning all of the time. And I feel like a lot of the things, the smaller things, I'm getting faster at, which is really nice. And I do see a difference in like how I draw labs, figuring out what works for me or like what time to start and like randomly doing weights and linens doesn't take as long anymore and it's like less daunting. I
Yeah.
yeah.
I love that. And I think that's totally normal. The longer that you're doing this, the more comfortable all of these little things are going to be. But never like, forget how far you've come. I want you to like feel that progress and feel that, oh, I'm getting more efficient with these things. And, take pride in that because you guys have all come such a far way. Selena, are you able to pop on? You're next on my screen.
Hey, I'm driving. I don't know if you can hear me.
Yeah.
But everything is going really well for me too. I'm starting to get some more higher acuity. Like the other day, I did my first UVC mind change by myself. So that went well. And yes, I'm also feeling like more comfortable doing like the little things, and I feel myself getting like more like quicker with cares, but also like the accuracy of like my assessments and stuff are like still good.
Yeah, that's wonderful. I love that. Karina, are you able to share?
Can you hear me?
Yes.
Okay. I think it's going pretty well. I think I'm definitely asking a lot of questions every single time I go into work, just to kind of like make sure that I feel comfortable doing it and I'm doing something, if it's new, correctly. But definitely feel like every day I'm learning something new, lots of new information, but also feeling a little more comfortable being able to do things by myself and knowing that I actually know how to do it.
Absolutely. That's great. I love that. Never lose that because it is, you're going to learn something new every single day. I'm seeing a theme with how everybody's feeling. And I think that, lean into that feeling of being uncomfortable. We talk about it on orientation. That's growth, and we want you guys to continue asking questions. And that's never going to stop. You're going to be here for years and years, and you're still going to have questions when you come into your shift and still find that you're learning something new every shift or every week. So never be uncomfortable about that. Okay. Looks like we had quite a few more people join our meeting while we were starting this. So does anybody want to, don't want to take up too much time. Does anybody have anything, pressing that they want to share? Anything that they're like excited about? Anything that they have experienced? No, we're all tired this morning. Okay, we'll move along then. Okay, so feedback that we've gotten, common feedback on the unit that we just want to share with you guys, nice little reminders. So keeping tidy rooms and tidy babies. I know we talked about this a lot on orientation, kind of the organization of it all, but really want you guys to see things through the eyes of the parents. We talk about never be that nurse that's just like covering up a spit up with a burp cloth. Make sure that you're taking that extra couple of minutes to really, clean up your babies, change your linens, make sure everything's nice and tidy in the room because kind of how you're leaving your patients really is a reflection of your care. And when parents come into the room, that's the first thing that they see. And we know that you guys are not, caring for these babies in like an unorganized or messy manner. So if you leave like trash on the bedside cart or, have that burp cloth covering like a spit up or anything like that, it just gives parents the wrong idea, right? So just make sure you guys are setting yourselves up and seeing things through the eyes of the parents. Okay. Retiming medication. So we've had some questions around this. We know that a lot of the times when babies have like, vitamins due, kind of non-time sensitive medications, sometimes it is appropriate to retime those meds, especially if they're not lining up with baby's feeds, things like that. But what about this example of gentamicin being due at 7:05? What do you guys think about that? Could we retime this med? Like a very inconvenient time for a medication to be due, right? Can somebody come off mute and tell me how they would handle this due time of gentamicin? Anybody? Would we retime this med?
Yes, I definitely retime it, and I'd also get in touch with pharmacy as well as the providers to see exactly when would be the most appropriate time to give the medication.
So biggest thing with our Carrie, were you gonna say something?
I was gonna say no, you cannot retime that one.
Yeah, so, and this is, this is why we love to put this example up here because it is, right in the middle of report. We don't want to be distracted when we're giving like such a critical med, such a crucial med for our patients. But biggest thing with our time-sensitive medications, so antibiotics, we cannot retime. So, we do have a little bit of a buffer window on each side of that due time. So gentamicin being due at 7:05, most of the time our report doesn't start until 7:05, 7:07, right? Because the oncoming shift, they're getting huddle report from our unit supervisors. Then they're coming to the unit, they're setting their stuff down, they're scrubbing, right? So I would go in the room probably at 6:55 and start getting my stuff ready to prime and hang this medication. The biggest thing is that you've got to work around that report. So, even if you have to stop report to say, okay, I have to give this med, antibiotics cannot be retimed. So 7:05, while it is very, it's inconvenient, we're right in the middle of other things. It may be that first instinct to be like, oh, okay, I want to be focused when I'm giving this medication, so I'm just going to retime it. But really, you've got to play with that like buffer time frame around that due time and say, all right, I'll go in at 6:50 and I'll still be within that like 30 minutes of giving this medication. Okay. Um, things like antibiotics, things like narcotics, pain management, stuff like that. All of those meds should be kept on their scheduled time so that we're doing right by our patients. Okay. Medication checks. So, after coming off of orientation, want to make sure that you guys are still practicing these good, healthy habits, making sure you're checking your 5 rights, making sure you're using Neofax. You guys will have another off orientation competency, which we'll talk about a little bit later, where we go back over med competency. The unit competencies yearly now are going to include med competency. So really want to make sure that you guys are practicing this on the floor when you have the chance to, and making sure that we're doing our due diligence with medications because we do give some very high risk meds in the NICU, and we want to make sure that we are, dotting all of our I's, crossing all of our T's. Okay. DSATs. So we do have a work group in process right now around DSATs because there has been just some discrepancy with, hearing nurses say like, well, that wasn't a real DSAT, or, it wasn't chartable. So really want to just talk about kind of the parameters on that and let you know that there will be soon to come some like standard guidelines on really what is chartable, what is not chartable, things like that. So biggest thing when your baby is alarming, we always want you to get eyes on your patient. That's the first priority. To be able to say like, okay, are they kicking their pulse ox? Is it half off their foot? Then fine, maybe it's just not reading, right? If they are sound asleep still, you have a really nice waveform, things like that, probably the pulse ox is picking up correctly. So then what is chartable, right? We want to make sure that if we have to recover our baby, so if we have to intervene to get them to recover, that is always going to be chartable. And then the time frame on how long those events last is kind of what that work group is ironing out with what is and is not chartable. So really want to make sure that we are talking to our provider team, talking to our charge nurses, always just get that second set of eyes because we never want something that maybe didn't need to be charted to delay discharge. And we never want something that does need to be charted or did need an intervention to go uncharted and then, have an adverse event at home or anything like that. Again, biggest goal is making sure that we're doing right by our patients. Vaccines. So I don't know if you guys have noticed, most often our vaccines are going to be ordered like all at the same time. So usually we have clusters of 3 vaccines at a time. And we used to have a practice where those vaccines, when it was time for vaccines to be given, we would give them like Monday, Wednesday, Friday, so that we kind of space them out for our patients. That was just always our practice on the unit, kind of what everybody had become accustomed to. The provider team has actually found that, research has said that it is better to give all of the vaccines at the same time because it triggers that like heightened immune response and it makes those vaccines essentially more effective. So biggest thing with this is that always want to make sure that you guys are talking to your providers. You are your patient's biggest advocate. if this is a baby who is, really touchy, on high respiratory support, swinging a lot, maybe they've already had kind of a rough week, rough night, whatever it is. Never wrong to just be like, hey, are you sure that you want to give these all on the same day? Maybe you could space them out like 2 on one day, 1 on the next day, whatever the case is. But just have that like open conversation and be thinking about those things. How is this baby going to tolerate 3 vaccines on the same day? Is it going to like make them backslide? Is it going to make them go up on respiratory support? Those kinds of things. Okay. Hands-on care with the doors closed. So we had just received some feedback that really on night shift that people were kind of closing the doors, doing hands-on care in private. Really, the doors of our room should not be closed unless we are trying to give parents privacy. So if mom is in there doing skin to skin, dad's in there doing skin to skin, mom's pumping, whatever the case is, absolutely give them that privacy, close the door. And use your little like privacy blinds on the doors. But when it's just you in the room, we really want to make sure that those doors are open for your safety, first and foremost, because we never want, you know, there to be any question about what's going on. We also never want there to be an event where, maybe your baby starts desatting, doors are closed, and you can't like leave the bedside to go over and yell out for help. So really want to make sure that the doors are open, that you're able to get help in the room if needed. And then another part of this is adequate lighting during hands-on care. So again, on night shift, we cluster our cares for a reason. Yes, we want to decrease stimulation as much as possible, but we also want to make sure that we have adequate lighting during our hands-on care and assessment. Every time we're doing hands-on care, we should be assessing our babies. We have had an uptick in PIV infiltrates, and some of that has been attributed to, the nurse says, I was just in the room, I just did a care, and then come to find out like they had kept the lights dim or they had kept the lights down when they were doing their care so as not to like disturb the baby too much. Really want to make sure that you guys have like adequate lighting, good visuals, so that when you are assessing your baby, you can assess all of these things that are really important and catch any of these early signs of, a PIV infiltrate, a dusky belly, things like that. Questions on the unit. So we talked a lot about this in your all's reflections. Never be afraid to ask questions. We want you guys we want you guys double checking yourself. We want you always having that verification for yourself. Always make sure that when you do have questions, you are asking somebody with a higher experience level. You don't know what you don't know. And I think that always going to somebody who has more experience than you, who is a seasoned nurse on our unit, is going to be to your benefit because again, you can have those good conversations of, things that maybe you didn't think about, things that you hadn't taken into consideration. So we always want you utilizing those experienced nurses on our unit as a resource. Okay. Make sure you're reading your orders. There are a lot of epic changes that have gone on in the last couple of months, and there are still more to come. A lot of the times there's like so much detail bogged down in the order set. So we really want to make sure that you are reading your orders thoroughly, expanding any of those hyperlinks that have like the order details in them, things like that, so that nothing's missed. Okay. Transpyloric feeds versus bolus feeds. So anytime that you are on transpyloric feeds, again, this goes with your orders. Sometimes it won't be explicitly clear what the time frame is, or sometimes I've seen where the providers have transitioned from bolus to transpyloric feeds for a baby, but maybe they forget to take out the one little part that says, over 2.5 hours or whatever it is. Transpyloric feed should always, always, always be continuous. So again, read through your orders, but always question that if you're seeing that there's so much in our feeding orders, so many like details and so many little caveats. So always make sure that you guys are keeping that in mind. Transpyloric feed should always be continuous. Fortification of breast milk. So this has come up with a lot of like our feeding changes, a lot of our fortifier changes. So want to make sure that you guys are clarifying if something doesn't make sense to you. So if you're seeing in the provider notes kind of that plan of that increased fortification and it just isn't making sense, the progression of that isn't making sense, always make sure that you're asking. Okay. Gentamicin loading dose. So this is an updated change on our unit. We used to give our loading dose slow push. You guys all remember that from your med competency, I'm sure. Loading dose was slow push, and then all subsequent doses were over 30 minutes. Really, that was to capture that like golden hour on admission so that we could make sure that all of our antibiotics were not only started, but completely infused within that hour. We have recently changed that process and have found that the evidence does not say that that's better or worse. So we have gone back to all of our gentamicin doses, loading dose and maintenance doses are going to be over 30 minutes. So no longer are we slow IV pushing our first dose of gentamicin on admission. Okay. We have seen an increase in feedback needed around devices on the unit. So make sure that you guys are not using your tablets, bringing laptops, using AirPods, headphones, things like that on the unit, or really reading like books on the unit really shouldn't be a thing. Even if you guys are, kind of enthralled with whatever you're looking at, whatever you're listening to, it takes your attention away from, maybe there's a baby desatting down the hall, maybe there's a baby crying down the hall, things like that. So when you're on the unit, we want you guys really making sure that you are engaged and that you are aware of your surroundings. And that's really just not possible if you're, looking at your laptop, you have your AirPods in, you're listening to a podcast, whatever it is. Okay. And then provider epic chats. So we are no longer with the unit supervisors have been asked to not be included in provider epic chat. So if you need to chat the provider at night, you do not have to include the unit supervisors. They have communicated to us that they still want you guys reaching out separately to them if you have any questions or need any clarification on things. This was a request that came from the provider team. So really just want to make sure that you guys are still using them as a resource, but they do not need to be like in that chain of communication when you're actually going back and forth with the provider. Okay. Any questions about any of that?
This is Erica. Just for night shift, we use that Fairfax NICU provider night team still, or no?
That I would have to get clarification on.
They created a specific thread, like we weren't really epic chatting directly any one provider at night. We were supposed to epic chat this Fairfax night team providers. So if someone's included in that isn't supposed to be, we wouldn't have control over who's connected to that.
Yeah, let me hold on one second. Let me get clarification on that for you guys, and because I actually didn't know that that was a thing. We just got an email from Katie Waskey last week who had brought this up and said that providers had requested this. So let me get clarification on that, and I will send it. We'll send it out to the group so that you guys all are aware. Okay.
Thanks.
Yeah. Thank you for bringing that up. All right. So competencies. So competencies on orientation that you guys had received, your car seat challenge competency. We have a bunch of you guys that have turned in your car seat challenge competency, which is wonderful. And then also your PIV competency. We know that you guys, the PIV competencies take a little bit longer to complete because there's so many things that go into that. You have to get 5 observations and then 3 successful insertions. But car seat challenge competency. So anytime that you guys are doing a car seat challenge on the floor for the first time, you should be getting signed off by an experienced nurse with that competency form that we gave you on orientation and system class. So make sure you guys are making that a goal in the next couple of weeks, months, things like that. PIV competency, again, we know that this takes a little bit longer. Just make sure that you guys are working towards this goal. Congratulations, Sue and Olivia. You have completed this competency, which is wonderful. You guys are ahead of the game. Never attempt a PIV alone. Again, always make sure that you guys are going to somebody with more experience to be that like second set of hands for you guys. Okay. We do kind of set the precedence that your off orientation competency, which we'll go over in the next couple of slides, we want these car seat challenge competencies and PIV competencies turned in at that time. Okay, so we are going to ask that you turn those in. If you need, one more insertion attempt or two more insertion attempts or need to get signed off by somebody, whatever it is, that's fine. We'll work with you, but just kind of set that goal for yourself that by competency day, you guys are getting these completed. Seek out those opportunities, seek out the car seat challenges if you haven't done one, seek out, admissions to be able to attempt sticking for a PAV, things like that. Okay. Mandatory off orientation competencies. So we have created an annual competency for those that graduate from our fellowship program. It really goes over, ensuring that you guys are continuing to practice those good, healthy habits that we instilled on orientation, and making sure that they're being implemented at the bedside. Your all's competency will be held August 1st and August 8th from 8 to 11. This is really good. We're going to split you guys up evenly. You only have to attend one, but it is going to be first come, first serve. So please email us if there is a date that works best for you. If not, we are just going to schedule you for one or the other, and then we will communicate with you what session you will be in. Okay. Both of these will be held in the middle conference room. We're going to go through very similar things that we went through on orientation competency. We're going to do line changes. We're going to do med competency, and then we will also do a mock code. The mock code is not a competency. It's not something that we expect you guys to come and be independent in. It really is just a learning tool for you guys that we have added because we've seen a need for you guys are like getting to that point of starting to take on more acuity. Being that nurse that like people are coming to you to ask questions. And so we really want you guys to feel comfortable, be able to get your hands on like the equipment, run through code scenarios, things like that, and get any questions answered that you might have so that you feel more comfortable going into those situations on the floor. Okay. We talked about this a little bit, so want to make sure that you guys are getting those PIV competencies completed, car seat challenge competency completed. Again, we will collect those at the beginning of your competency day. And then we went through all of this stuff already. So we'll do medication competency, emergency scenarios, mock codes, and then central line change. Okay. Goals for yourselves that we would like for you guys to set, some things that you guys can start getting more involved and getting more knowledge under your belt. The stable course. So the schedule for this is on Teams. It is in person every other month, rotating care sites. This goes over stabilization of a sick or premature infant in all settings. And then stable stands for sugar, temperature, airway, blood pressure, lab work, and emotional support. This is the certification that you can take for our unit. It is really wonderful. We do ask that you guys have been here for a year before you take this. But it is just another way to kind of brush up on all of that knowledge and get some extra information under your belt. Make sure you guys are attending UBC. It is the second Thursday of every month. The next one will be held on May 8th. This is like the way that our team gets information out to all of you guys. So it is an expectation that you guys are attending these regularly, so that you can stay up to date with any changes, committee work, things like that that's going on our unit. You do get paid for this time, so it is worth your while. Precepting. So you guys will be precepting before you know it. Believe it or not, I know that that's probably scary for some of you, but we really want you guys to feel comfortable and supported when that time does come. So if you are interested in kind of dipping your toes into that pool at this point, you guys can reach out to us. We have students come in kind of in waves. We have, I think, 2 right now. But if you're interested in kind of dipping your toes into that water, we could set you up with precepting a student. It's kind of a nice way to have like a, low stakes. They're really just shadowing you, precepting experience. Okay. So if you're interested in that, please reach out to me, Carly, or Sarah. Certifications that you guys can start to take. So ELBW at 1 year. Inova does reimburse for these certifications and pay you for your success in these things. So again, a nice little incentive to continue your growth on our unit. And then committee involvement. So we have tons and tons of committees. Pretty much everything that goes on in our unit is kind of functioned through one of our committees or work groups. So really, we want you guys to like find your passion, talk to your team, see if there's anything that you guys would be interested in working on. And you can join those committees starting at a year. We really want you guys to like get your footing under you and then continue integrating into our unit. Biggest thing that we did just change is that we have a fun committee, fun and retention committee, that they kind of organize like all of the um, events that we do for our team, any of like our team building things, potlucks, stuff like that. They do a lot with like t-shirt sales, stuff like that, to get all of our team kind of involved, bring our team together. That we have kind of lowered that 1 year requirement. So you can join the fun and retention committee if you're interested in that at 6 months. If you guys are interested, just reach out to me. Marianne Hall is one of the chairs, and I believe Victoria Chiodo. I would have to double check on that though. So reach out to Carly and I. We do have slides that give all of the information for the fund and retention committee. So if you're interested in that, we can send you that information. Okay. Goals continued. So mock codes, like I said, we're going to be doing mock codes in competency day, but we also have started hosting every other month on the unit. Last Thursday of the month, we host mock codes. On day shift, the option is from 2:30 to 5:30. That's kind of just like a rolling time that you guys can pop in and be a part of those things, ask questions. On night shift, it's from 9:30 to 10:30. Location is announced that day, usually in one of our NICU rooms, depending on like what we have available. Those are really wonderful for you guys to go to. Again, the more exposure that you can get to like the equipment, bagging, compressions, the CO2 detector, the more comfortable you guys can get with all of those things, the better. And then training goals. So SBU class you guys can take once you have been off orientation for a year. The cooling class you can take after you've been in the NICU for 2 years. And then we're always looking for super users for different things that we're rolling out. We just rolled out like a heel stick competency where we're kind of revamping those things, that education. So anytime that new processes are coming out like that we have a new project going on the unit, we're constantly looking to the staff for super users who feel passionately about those causes. So again, we announce those things on UBC. We would love for any of you guys to be a super user if it's something that you're passionate about, and just like another nice way for you guys to get involved. Okay. That is everything that I have for you guys today. Really just wanted to take this time to say that, we're still here for you guys. We want you guys to be successful on our unit. We want you to be happy on our unit. We are going to do, like I said, our check-in August 1st and August 8th. So please make sure that you guys are emailing us a preferred date for that if you care which date you're in. If you don't care, we'll just assign you to one. And yeah, that's really all I got. So you guys can pop off of here if you have questions. I'll hang out for the next 5 minutes or so. We are ending a little bit early. So you guys just let me know what you need. Okay. And if there are no questions, then I'll see you guys soon.
Jordan, I did have one question. I was just wondering, I did have a few family members that wanted to have me as their primary nurse, but I was just wondering, like, when exactly would that be possible for us, or like extended? I've had one baby that I've had extended care where like I wasn't necessarily the baby's primary nurse, but they were able to get me back with that baby for a couple more shifts.
Yeah.
Yeah.
Yeah, primary nursing, to be honest with you, rolled out after I was already kind of in this role. So I don't know all of the ins and outs. I don't know if there's a time requirement that we want you guys to be here before you sign up to be a primary nurse. A year? At a year, Carly just told me. At a year, you can sign up to be a primary nurse, but there are all of these different things. Like we have so many families who are maybe not needing like primary nursing, but are needing continuity support and things like that. So if you feel like you've bonded with a family and you feel like you have a good rapport with a family, always communicate that to our unit supervisors, because even if we're not doing like the primary nursing system or primary nursing like setup, we can still look at that for continuity because you guys are, you're so valuable with the connections that you make with our families, even if you're not like that technically primary nurse. Okay.
Okay, perfect. Thank you.
Yeah. Any other questions?
I have questions about like how like workforce and holiday switches,
Yeah.
and I feel like we really kind of never talked about that. And I'm seeing like a lot of terminology and like the switches page being used. I just don't understand, or like if you need someone to come to a shift early or you want to trade
Yeah.
holidays, like do you still trade a shift in that week of the holiday and then plan to trade later? And just like I'm just not really understanding those types of things about the
Yeah.
switching.
Yeah, so we know the scheduling is like it's a lot with everything that goes into our unit. They do, UBC again, huge plug for those kinds of things, especially when it comes to like summer workforce. Biggest thing with workforce, just to kind of address that first, is that I haven't seen exactly what's on the switch page, but most often what they want you to do is, if you didn't get PTO for the week that you had initially requested, you have a vacation that you want to go on, you can post in the switch page asking for a work for, essentially saying, Sue, can you work an extra shift this week on top of your 3 already scheduled shifts to cover one of my shifts this week? And then if Sue agreed to that, that would give you PTO for that shift. So Sue would be picking up that shift, working for you, but then you would have PTO for that one shift. With the holiday switches, a lot of the times what they're saying is like if somebody's doing a work for you or doing a holiday switch for you, a lot of the times they'll just say like it's not mandatory, but when you're posting for those things, you may want to like sweeten the deal and say, hey, if you can work my, switch on to my Christmas for me, I'll work an extra weekend for you in exchange or whatever it is. So a lot of the times they're just talking about like deals that they've seen made in the past, to make sure that it's like a fair, cohesive switch for everybody. But occasionally too, you will have people who are just like, I don't have anywhere to go for the holidays. I don't mind working them. I could use the extra money, so they don't ask for anything in return, right? Does that kind of answer, or did you have specific questions related to other things that you've seen?
I guess, yeah, that does start to answer some of the questions I've had and that I've heard other people asking. Like, um, if someone's gonna work, like I'm supposed to be on Memorial Day. If someone's going to cover my Memorial Day shift during that week, I can either do it as a work for, or I could take one of their other shifts. We could switch that same week, you're
Correct.
saying?
Yep.
And
And
then once we decide we're going to do a work for, is that something we submit through Smart Square, or do we have to email schedule committee to get that like approved?
for summer workforce, it has to be approved by the directors. So I would email your director and the schedule, like CC the scheduling committee, just so that everybody stays in the loop.
There's
Okay.
a form for summer workforce that we
Oh.
can fill out. There's like a QR code that's been on the like huddle message, like from last week
Weekly
or 2
updates.
weeks ago. Yeah, on the weekly updates.
Perfect. Thank you, Betsy.
Is it the same one that's on the flyers?
Yes.
So I can't access that for some reason. It says I don't have permission.
Interesting. I
So I
would
guess I've never
I
email.
have the
got
same
to see it.
issue.
Okay. Just for the flyers or for weekly updates?
For the QR code for me.
Were you scanning the flyer or were you scanning weekly updates?
I was scanning the one from the weekly updates, and I kept like refreshing the page, but like I couldn't see it. I couldn't access anything on that end.
Interesting. I would email Jackie about that, and just tell her that you're having access issues for the work for like QR code. Because we don't like own that. So I don't know if it's something with like the permissions. I don't know if it's something with the QR code itself, but I would email Jackie about that.
Jackie, does she have a
Rommel.
last name? Oh, okay.
Yeah.
I think it's Dr. Ramel. Yeah.
Yeah.
Thank
And
you.
then the only other caveat, Erica, that I was gonna say with that is like if you're, let's say, switching like Memorial Day for Labor Day, so like if you're doing like a fair holiday trade, we have like implemented a new kind of rule that, we saw there was one year that a bunch of people said like I'll work your Christmas for you. And there was a handful of people who had made that switch and then left before, like they made that switch knowing that they were going to be resigning before Christmas, which leaves us obviously with like big gaps on the holidays. So let's say you are going to work somebody's Memorial Day and they're going to work your Labor Day. If they resign before Labor Day, but you've already worked their Memorial Day, you do still have to work that holiday that they were going to pick up. So that's like the big caveat with those things. That hasn't been an issue since that happened because people know like I can't just say that I'm going to make this switch and then, not honor that. So, but just something to be aware of. Okay. Any other questions about scheduling, workforce, or anything else unrelated to that? You still have a handful of you guys on. What's on your minds?
Thank you. I hope
I
you
had a
guys have a
quick,
good day.
oh, sorry.
Yeah.
No,
Thanks,
you're
Coco.
good. Bye.
What's going on, Enma?
Oh, I was wondering if we were getting paid for this time, or do we or I don't know if we are or not.
Yeah, you're getting paid, and I will submit the roster to Saj, so you guys don't have to worry about it.
Okay, thank you.
Okay. Kaylee, Erica. Oh, Kaylee hopped off. Erica, anything else I can do for you?
Thank you.
Bye.